Hello everyone, it's Dr. Huynh from West Valley Naturopathic Center. Today I would like to discuss about some diagnostic lab as well as biomarker for to assess heart health, more specifically coronary arteries disease risks. The basic blood work for cardiovascular health risks, including a lipid panel and the blood sugar management check through hemoglobin A1C. More than that, or the regular panel can help with identify the factor that may affect heart health. For example, even as basic as a complete blood count or a comprehensive metabolic panel. So those are basic lab. The lipid panel will give information about the bad and good cholesterol level and the total cholesterol, and then the hemoglobin A1C will give information about blood sugar management for about 60 to 90 days from the time of having blood draw, because we all know that cholesterol and blood sugar, if they are not well managed, they will have negative effect on cardiovascular health and increase the risk of heart disease, coronary arteries disease. I just want to mention this a little before I go further into a more in-depth cardiovascular assessment and biomarkers. That vital signs are very important. So blood pressure reading, I recommend if you have a diagnosis of high blood pressure or a abnormal blood pressure reading, make sure you check your blood pressure, monitor your blood pressure, ideally daily. And if you don't have a diagnosis, you go to your doctor every 3 months, 6 months, or a year. They will do a vital sign in the office. Make sure you got your blood pressure checked. Physical exam is also very important for the coronary artery disease, heart disease check, prevention or management. Is the doctor will listen to your heart, and then also will perform other physical exam to see how your circulation go and etc. And then go back to the biomarker for her health. Beyond the basic blood work, there are markers that help identify the cardiovascular health risks. For example, ADMA, SDMA level. So those are the biomarker for heart health, more on the ADMA. The SDMA is for kidney health. ADMA will suggest about if ADMA is high, it may suggest that there is an damage into the innermost layer of the blood vessel, which is the endothelium. With that, it's called endothelial dysfunction, and that will increase the risk of coronary arteries disease. Other marker like TMAO also is a cardiovascular disease risk, specifically coronary artery disease risk, and that can be modified by diet, lifestyle, and supplement. MPO is another marker for cardiovascular disease risks, specifically coronary arteries. MPO is made by the macrophage that will go inside or go to the side of inflammation or damage in the blood vessels, and high MPO suggests a higher risk of coronary artery disease. And then omega check is really important because a low omega-3 level suggests a higher cardiovascular risk. Also, a more in-depth lipid panel called a NMR lipid panel will look into the particles and the size of both the good and the bad cholesterol and tell us more idea about how good or how the cholesterol management happen in the body so that we can have appropriate intervention. So those are some of the biomarkers that we use beyond the basic panels. There are other markers. It depends on the individual that we will check to identify the risks and will treat appropriately. If you have any question, feel free to reach out to one of the doctors and we're happy to assist you. Thank you.